I know for a fact without Suboxone, I would most likely not be here today.
A new partnership between the Michigan Department of Health and Human Services and key funders has formed to focus efforts on medically assisted treatment in hospital emergency rooms. The goal? To decrease opioid overdoses and deaths. In 2017, drug overdoses killed nearly 2,700 people in Michigan. 70% of those deaths were attributed to opioids. New tonight, ABC 12's Amy Hybels met with a doctor who is a licensed addiction provider to get his reaction to this new 2-year pilot project.
That's right, Matt. Dr. William Morrone at Recovery Pathways in Bay City tells us that efforts to address addiction in the ER are about 4 to 5 years overdue.
If you go to ER and you have bronchitis, you're probably going to get steroids and an antibiotic so you can breathe better. We have not had an emergency department aggressively address that patient's addiction right there.
So why does that matter?
And you overdose and you go there and you withdrawal and they don't treat that. Who's the first person you call when you walk out the door? Your dealer.
Dr. Morrone says the highest risk for overdose death and substance use disorder are people coming out of a non-fatal overdose. Recovery coach Kyle Hanshaw considers himself lucky. He was placed on a month-long waiting list for treatment. He was still alive for his appointment on July 8th of 2013.
I know for a fact without Suboxone, I would most likely not be here today.
The father of 3 says there's still a stigma attached to medication-assisted treatment, a mindset that he says needs to change in order to save lives.
Any tool that can help you stay alive and help me stay alive and be able to be there for my kids is worth having. If there's breath, there's hope. And I have breath today.
Now, tonight I spoke with a senior program officer for this initiative. She says that they have about $2.5 million in grant funding for emergency rooms across the state. Unfortunately, we're not going to find out until January if any hospitals right here in mid-Michigan are going to be able to get some money for this initiative. Reporting live in Saginaw, Amy Hybels, ABC 12 News.
Fentanyl.